Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everybody. Today we have to discuss a very important lecture in Introduction Week for Semester 9. It's about etiology of clinical picture, etiology and the clinical picture of substance use disorder. I am Dr. Muhammad Adil Hadidi, Professor of Psychiatry and Head of Addiction Unit in Mansoura University, and it's my pleasure to be with you for this interesting and very important lecture. The ILO for this lecture will be definition of addiction, etiology of substance use disorder, clinical picture of dependence, and clinical picture of specific drug use. We will not discuss in this case the management of addiction because the management will be in later weeks. Okay? Why we study substance abuse or why we study addiction? You will encounter, because sometimes many of us can be encountered with it. It could be happen to you. You need to know how to deal with it. You have to help in elimination of the negative attitude about the addiction and addicted people. Substance abuse and addiction is a treatable disease, so you have to know how to treat this, and you can make a difference. Yes, you can make a difference by changing the attitude, by guiding the people to treatment and helping them to treatment. So there is a very important quotation by Carl Gustav Jung, which is a very famous psychiatrist, knowing that every form of addiction is bad, no matter whether narcotic, alcohol, morphine, or idealism. It means that from the very early period, there is knowing that addiction is not only drug, but even idealization. It could be addiction, or any behavior could be addiction. So we can say that definition of addiction could be two parts. First part is general definition of addiction, which means devoting oneself to habit or behavior, but this not excludes the choice or responsibility. The other part is a specific and strong physiological and psychological dependence on the drug or other psychoactive substance. Definition of addiction means that are different types of addiction. General addiction could include food addiction, internet addiction, TV addiction, gambling addiction, and sex addiction. So addiction is not only drug addiction, but there is many behavior changes or behavior patterns that could be addicted. Naturally, we have a reward. Reward, it means that there is good feeling by doing something good, like eating food, and this food is nice, or drinking water when you are thirst, having a sex, or doing something is in successful way, sometimes playing sport and so on. This is natural word. When you do this behavior, you will feel happy, and the happiness will be transformed in your brain to neurotransmitter and the chemical that make you feel happy, and this is called natural word. If we see this figure, we see that after using the food, there is a surge of increase of dopamine level by using or eating a good food. Also, after doing intercourse, we have a good increase in dopamine level, and dopamine is the source of being happy and feeling happy after doing normal behavior like this. But addictive people learn how to increase this dopamine without doing normal behavior but using drugs. Some definition is very important to know about addiction. First of this is intoxication. And the intoxication refers to psychological and physical changes associated with recent psychoactive drug ingestion. On the other hand, withdrawal state is symptoms and signs following cessation of heavy use of substance, like dependence. Tolerance is the need for increase the amount of substance to achieve the same effect. On the other hand, the cross tolerance means that tolerance developed to one drug as a result of the use to another drug. So if I use or I am dependent on some drugs, and this drug is not available, I can use another drug with same mechanism of action, and I will feel the tolerance for the same for the new drug. Okay. Abuse is a maladaptive pattern of substance use, such as extending that the serious interference with health, occupation, and social function. Drugs are variant according to the mechanism of action and the duration of action. So if I use a very rapid action and rapid in and out, it leads to more dependence. It's like Valium, or it's like Xanax, for example, which is benzodiazepine. Sometimes you use a long effect or rapid in and slow out, like Valium, morphine, or using slow in and slow out like methadone. So the difference between the drug depend on to how this drug is action on your body. If you use drug which rapid in and rapid out, is more likely to be addict. But using drug which is slow in and slow out, it lead to less effect of addiction. We have different administration for different drugs. It's losing some using drugs like smoking, some using snuff, some using injection, some using by burning. It is different way, and all lead to the drug will be enter in your body. And the most effective or the most rapid action is usually by smoke, followed by injection, intravenous injection, followed by intramuscular injection, and lastly sniffing and oral. So oral is the least way to give the effect for substance use. Addiction is a brain disease. And why we say it is a brain disease? Because it depends on what is called tolerance, and tolerance caused by change in the brain chemistry. How people become addict and the other will not become addict. It means that some people once use the drug will be addict, other will not be addict after using the drug. Why? Because we say we have what's called vulnerability. And vulnerability, it means that some biological factor, psychological factor, social factor make the people to be vulnerable to be addict. Once they use the drug, this vulnerable factor lead to what is called brain switch. And in this way, the brain change his advantage and change his chemical transmitter, leading to what is called dependence and addiction. And if he stop treatment, or if he stop this substance, he will feel withdrawal symptoms, and he will stress triggered exposure, and leading him to be addict. So what is the biological factor that play role in addiction? As we say, we have psychological factor, social factor, and biological factor. First, we will discuss biological factors that play role in addiction. We have to discuss genetic factor, neurotransmitter factor, and brain area. We have many many genes, and all these genes play roles in addiction. We cannot say that addiction is only one gene. It's multifactorial genes. Some gene play on the dopamine receptor gene, and other for cannabis receptor gene or serotonin receptor gene. All these receptor genes play roles in the effect of the drugs and play roles in addiction. We don't need you to study or to have to keep in mind all these genes, but you have to know that genes play an important role in addiction. So some family addiction is inherited in this. Okay? The neurotransmitter playing role in addiction, first one is dopamine, later second one glutamate, GABA, which is gamma aminobutyric acid, serotonin, norepinephrine, corticotrophin releasing factor, opiates, and cannabinoids. All these are neurotransmitter play roles in addiction. We may be focused on some of them, but not all, because it need much more long time. But the most important one is the dopamine. We see here that GABA playing role in some addictive drugs like alcohol, benzodiazepine, and non-benzodiazepine, Norepinephrine playing role in cocaine, amphetamine, methamphetamine. Serotonin plays role in hallucinogens, LSD, and cannabinoid receptor play role in marijuana, acetylcholine, and so on. We have different type of neurotransmitter according to different type of drugs. Brain reward system. What is meant by brain reward system? In our brain, we have certain system that give you pleasure or feeling pleasure if you're doing something good. So this is called the reward system, reward for doing something good. And the main mechanism of action or the main neurotransmitter functioning or doing its action on this, it's called dopaminergic neuron. And this dopaminergic neuron originate in ventral tegmental area and project to nucleus, which is called the nucleus accumbens. And nucleus accumbens is the site for feeling happiness, and so it is the most important nucleus in the body corresponding to addiction. So increase dopamine in nucleus accumbens leading to feeling more or less happiness and feeling that you feel euphoria. And this way is responsible for most of drugs, especially for amphetamine and cocaine. If you see this figure, ventral tegmental area is down here and passing dopamine to nucleus accumbens, then to prefrontal cortex. Prefrontal cortex is the area responsible for taking decision. So if one taking drug for one time and he feel happy by its action by releasing dopamine in nucleus accumbens, he send impulse to prefrontal cortex saying that what we do now, which is taking drug, leading me to feel happy. So I will repeat again and again taking drug to feel more happy for the drug. Okay? Next, if we see this, there is a nerve ending, and normally neurotransmitter is passed and stored in the vesicle in the nerve ending. It will be passed and stored in this. After stimulation by impulse, nerve impulse, the neurotransmitter will be passed from the vesicle and passed to affect the neuroreceptor. And as we say, the increased dopamine is responsible for feeling happy. It means that any drugs that increase dopamine leading to more increase in happiness and feeling more happy. So we have different mechanism of actions that leading to increased dopamine, but all the drug leading to increased dopamine. First mechanism of action is release of the dopamine. Here we have released dopamine in the vesicle and reverse the transporter to leading to. So release dopamine inside the nerve ending, and we have transporter that mean lead to reverse its action and so leading to pass and increase. Other mechanism of action, this is normal, here stored in the vesicle. Once impulse came, and this impulse leading to release of dopamine, and this dopamine will be bind to receptor leading to its action. It's most commonly with opiate and nicotine, marijuana, and alcohol. Other mechanism is to prevent this dopamine after it being released into synaptic cleft. It prevent to reuptake again to vesicle. This is occurred by we have certain enzymes which make the dopamine transporter gene, dopamine transporter enzyme. If we block this dopamine transporter, so dopamine will be maintained in the synaptic cleft, and so it is prevented from the passing inside the cleft, and we have dopamine accumulated in the synaptic cleft, giving or feeling more effect and more dopamine. This is the function of cocaine and Ritalin. We have here tetrahydrocannabinoid receptor. It's a special receptor responsible for cannabis. And lastly, we can say all drugs mainly increase dopamine. And this dopamine leading to feel happy and more feeling euphoria, which is responsible for using drug or feeling high. After long use of drugs, we have here more dopamine in postsynaptic cleft. And this more dopamine leading to be more feeling high. But as a reflex of this feeling high, we have a dependence, and this dependence we will discuss by later in another slides. Here, in summary, we have different mechanism of action of drugs that leading to the increased dopamine. For example, alcohol inhibit GABAergic neuron, and this GABA, GABA is an inhibitory neuron, but he inhibits the inhibitory GABA neuron that inhibit normally the dopamine release. So we have GABA neuron responsible for inhibition of dopamine release from ventral tegmental area. If I inhibit the inhibitory neuron, I lead to increase the release of dopamine. So the main mechanism of action of this is to inhibit the inhibitory neuron, leading to increase for release of dopamine. Another part, heroin. Heroin is binding to opiate, and this opiate receptor also inhibits the GABAergic neuron that prevent the release of dopamine, so inhibiting it leading to increased ventral tegmental area. Cocaine, as I said before, its function of through dopamine transporter by binding to it, so inhibit its transporter to the nerve ending, and so leading to release of this. Nicotine also activate cholinergic neurons, and this cholinergic neuron project to dopaminergic neuron responsible for increase of dopamine release. In summary, all of the drug should act on the reward system, and especially for nucleus accumbens, and all of the drug should increase dopamine transmission in this nucleus accumbens to feel happy and to be dependent for the drug. If one stops the drug, as sudden stop the drug or sudden decrease the amount of the drug, it leads to what is called withdrawal symptom. And this withdrawal symptom is caused by different factors. One of these is autonomic nervous system, thalamus, and corticotrophin releasing factor, and locus ceruleus responsible for release of norepinephrine. Once all these are doing so, if we're stimulating like this, stimulating sympathetic function and the release of norepinephrine, leading to increased heart rate, increased blood pressure and glucose, and also feeling to more feel as not ease. And this is explain why people once stopped feeling very angry and very irritable, because increased sympathetic symptom and norepinephrine and corticotrophin releasing factor leading to more sympathetic activity, and this is bad feeling. This explain they rapidly search for the drug and taking the drug to avoid this bad feeling. So intoxication and withdrawal effect for drugs. Once intoxication or taking the drug in much amounts, the dopamine leading euphoria, opiate leading to analgesia and relaxation, serotonin increase mood, GABA decrease anxiety and less panic, while withdrawal symptoms lead to dysphoria by decreasing dopamine, decreasing serotonin, dysphoria, and opiate increasing pain, increasing anxiety and panic by decreasing GABA, and feeling stressed and so on. So patient will feel dysphoric, irritable, depressed, and angry once he stops the drug, and this make him to feel very bad feeling, and he searched to taking drug to avoid this bad feeling. The model of craving, why we have craving? Craving is feeling thirst to take the drug. Once the person taking the drug, he feel increase the dopamine concentration in his brain, and this dopamine increase his drives and feeling very happy was using this dopamine, and this making him a pleasurable effect. After he stopping this dopamine, after he stopping taking the drug, he feels that dopamine become less, and once he making a behavior, this behavior is connecting with drug. It's like seeing the drug, seeing the place he taking drug with. There is a conditioned reflex leading to stimulation for the certain area of the brain. Remember them that this condition or this behavior is linked with dopamine release. So he feel happy and he feel urge, and urge is much more urge aiming to take the drug to feel more happy. And so, elevated dopamine is associated with people, place, and thing stimulus. And when stimulus present again, there is a burst of dopamine or drug-seeking behavior, lack of dopamine leading to restlessness and irritability and discontinue, and the brain reacts differently if the drug is present or not. This was the biological factor as we discussed before. Now we have social factor. The one of the most important social factor is the availability of the drug. So once a drug is available and low in cost, it will be widespread, especially in people who have poor condition, and people taking them is very easy. Advertising on the modeling, sometimes you see a model or role play model. If you see a movie, for example, and in this movie people taking drugs and feeling happy, you sometimes want to take the drug to feel happy like them. So advertising and the modeling is indirect way to say for people that if you taking drugs you will feel happy, and this making them to take and continue taking drug more and more. Peer pressure is very effective and very important rule, because people, especially young people, sometimes imitate their models and their peers in certain setting. Sometimes when people say, I have the pleasure with taking this drug, you have to try this drug, you have to be strong if you're doing this, you have to be like man if you use this drug, and all these sentence making some people to do, or especially young people, to take the drug even to try. And if they try and they have the gene responsible for addiction, they will open this gene and leading them to continue taking drugs more and more. Sometimes law and customs, now many countries are now it's legal to use drugs and legal to use like cannabis, and this country leading to much and much more availability of the drug, and leaking there is widespread for drug use. So this is our social factor responsible for drug use. Psychological factor, now we ended biological factor, social factor, and now we have psychological factor. What is psychological factor responsible for taking drug? First, we have motivation to use the drug. It is responsible for the start of use the drug, or the first time to use the drug. Why people use the drug in the first time, and why they choose this certain type of drug and not choose the other type of drug. And the other part, which is called learning, and the learning is responsible for continuation of the use of the drug. So some people is motivated to use the drug, and after they use the drug they will learn to continue the use for the drug. So motivation for the use of the drug is depending upon according to expectation for the use of the drug. For some people who are little stimulated, they are lazy, they don't have experience, they have social phobia, for example. Sometimes using drug which is stimulant or leading them to decrease the anxiety, and so they can stimulate, they can work more and do much more. So lazy people usually use stimulant drug. On the other hand, people which are anxious people, irritable people, used to take the sedative drug. So they expected, if I do this, I feel more happy and I will solve my problem. So they continue using the drug for long period, and they choose these certain types for drug. Learning also is responsible for continuation and the use for the drug. How learning using leading for continuation? Once you use the drug, there is a cue, which is conditioned stimuli used to enjoy the pleasure response, and using the drug is conditioned by or linked by the feeling happy, and also stopping the drug is conditioned by feeling anxious, irritable, and so on. So the people usually used the drug to feel happy and to avoid the withdrawal symptoms by stopping the drug. These are different way of learning, which is called the classic conditioning and operant conditioning and avoidant conditioning. All these conditioning types play role in learning that people to continue use the drug and do never stop the use of the drug, otherwise they will feel not good. Personality of the people or personality of the patient. Antisocial personality and borderline personality are very common to use the drug. Psychodynamic factor is responsible factor also for the use of the drug. Inability to face or to deal with reality, to suppress high anxiety feeling, self-medication in case of depression and feeling, all these factors playing people making people to take the drug. So if I have high anxiety and I cannot deal with this anxiety and depression, sometimes I try to take drug to feel more happy and to relieve my anxiety. Learned behavior, as we say, I can learn the behavior using of drug from my family, from my peers, from the use of the drug for one times, and I feel very good and stimulated drug. So I learned that I can continue to use the drug more and more, and this make me very happy. Reinforcement of the drug effect leading to more continue for use the drug. Psychological factors also include that depression, anxiety, or other psychiatric disorder. All these could play roles in making the drug and stop drinking to you continue using the drug. Till now, we have now ended the first part of this lecture about the conditioned or the causes of the drugs, the definition of the drugs use, and the causes of substance use for the drug.